We'll continue our presentation on the role of nutrition in Alzheimer's disease. And our next presenter is Mrs. Daniel الخوتاني. She's a senior clinical dietitian at Prince Sultan Military Medical City.
Assalamu alaikum wa rahmatullahi wa barakatuh. Good morning, everyone. I'm very glad to be here today to talk about a very important topic in our career, which is the role of nutrition in Alzheimer's disease. Where is it? Oh my God. How can I go back? During my work in Prince Sultan Military Medical City in the ER, we're facing a lot of challenges. And one of the daily challenges during my work in the ER is dealing with Alzheimer's patients who's admitted to ER with hypoxia, low level of consciousness, dysphagia, and their family always refuse to insert the nasogastric tube feeding to assist those patients who's suffering from the malnutrition. And the most frequently question in the morning round with the doctors, always they are asking, how can we initiate feeding with those patients, either orally or intrally? What can we deal or what can we do with those patients who are suffering from constipation and diarrhea? Is there any supplements or product they can use it? The answer is yes. And inshallah, today we will talk more about all of these points in details. So, today I'll highlight on a couple of points. First, I'll talk about the malnutrition in Alzheimer's disease, then how to feed Alzheimer's disease. Also, can we reduce the risk of Alzheimer's disease? At the end of our talk, I'll talk about the recommendations. Let's start with testing your new knowledge about the Alzheimer's disease. What is the best diet for people with Alzheimer's or dementia? Is it DASH diet, Mediterranean, mind diet, calorie restriction, ketogenic diet? Any ideas? Just raise your hand, please. Which one is the best? Mediterranean, yes. What else? Mediterranean, great. Okay, actually, oh my God. Sorry for that. The answer, okay, is the mind diet. It's a combination between the Mediterranean and also the other diet. I will talk more about it, inshallah, later. Can we reduce the risk of Alzheimer's disease? Yes or no? Yes. Good. Okay. The recent paper published in the last 5 years, they just conducted, there is a link, good link and great link between the stomach and the brain. Do you believe of that? The gut-brain axis? Yes, thank you. So now, let's start with the malnutrition. What do we mean by malnutrition? As simple as it is, malnutrition involves under and over nutrition in the Alzheimer's patients. Several recent paper reported that 20 to 45 of those Alzheimer's patients suffering from significant weight loss over 1 year. The underlying mechanism of weight loss and the malnutrition in dementia patients is complex and multifactorial. It's really important to pay attention for anorexia, sarcopenia, and cachexia, which is like the metabolic alteration in Alzheimer's patients. And if we didn't deal with it, seriously, they will end up with multiple complications. How can we differentiate between them? Here is in the slide, just we can know how can we differentiate between the cachexia, which is unintentional weight loss, the sarcopenia, which is low muscle mass, strength, and also physical performance, the anorexia of aging, which is loss of appetite with decreased oral intake, the virility syndrome, which is the multi-syndrome of the low physical reserve with the diminished of the capacity to respond to the stressor. Now, what are the causes of malnutrition in Alzheimer's patients? There are so many causes, such as swallowing problems, xerostomia, restricted mobility, and so on and so forth. Here is a recent paper published in 2022. They reported that multidisciplinary care team can contribute to decrease malnutrition and mortality in the Alzheimer's patients. Let's move to the second part of our talk today, which is malnutrition in Alzheimer's patients. How can we assess the malnutrition in Alzheimer's patients? In our hospital, we're using the same firm. Actually, this is the first step on the way of assessment and formulating the plan of intervention in Alzheimer's patients. So risk assessment to identify how patient is malnourished is crucial in order to know how can we start nutrition intervention. By using many nutrition assessment forms, we can determine the severity of malnutrition in Alzheimer's patients. And the score, actually, they divided them into 3 categories: the normal nutritional status, the at high risk of malnutrition, and malnourished patient, and the intervention must be individualized according to the stage of malnutrition and also the disease. Here is coming the big question, the core of our talk today, which is how to feed Alzheimer's patients. It must be individualized, as we said before, according to the patient condition, the disease stage, which is the patient with mild phase, we can start oral diet with oral supplement. For patients with moderate phase, we can start oral diet with oral supplement, just to be careful with the signs of dysphagia. For patients with severe phase, we have to start enteral feeding as early as soon as possible. And this is what's happening in daily scenario in the ER. And here is a person-centered approach. How can we calculate calorie requirement? This is the most frequently question in the ER and even in the grand round. How can we calculate the calorie requirement for the Alzheimer's patients? As simple as it is, we can use the weight-based equation, which is based on the BMI. So the patients with BMI less than 18.5, we can give 15 to 30 kilocalorie per kg. For patients with BMI 18.5 to 30, we can give 18 to 21 kilocalorie per kg. But for patients who are suffering from obesity, we can use the Mifflin-Stiger equation. Regarding the protein, always the minimum amount of protein going to be 1.2 gram per kg to 1.5 for in and out patients. Regarding the micronutrients, no need to give like micronutrient supplements unless the patient he cannot get the requirement from the natural sources. Regarding the fluid, there is a special consideration as we know in the heart failure patient with low ejection fraction, patient who's suffering with anostorica, edema, we have to restrict the fluid. But in general speaking, we can give 1.6 liter per day for women, whereas for men, we must go for higher amount, 2 liter per day. Now, how can we prevent and treat malnutrition in the dementia, Alzheimer, and also geriatric patients? Here is a recent recommendation from European Society of Parenteral and Enteral Nutrition published in 2022. They recommended to focus on the texture and the oral supplement and mealtime, also the meals on the wheels for patients who are living with their family. While for the patient in the hospital who can be orally fed, we can start oral diet, mind diet, focus on calorie-dense diet, and also to start oral supplement to focus on instruct the patient about the diet before discharge and to give supply after home. So many healthcare professionals and also the families were questioning about the differences between the Mediterranean and the mind diet and also the DASH diet. The recommendation, the papers, the recent guidelines recommend to go for mind diet, which is a combination between the Mediterranean and DASH diet with less carbohydrates, simple sugar, and also processed food. And it's really important to pay attention for the factors that can be positively or negatively affect the patient health and status. Here is the food rich in the antioxidants and anti-inflammatory components such as vitamin E, C, B vitamins, polyphenols. It can be positively affect the patient status, whereas the high processed food, the saturated fat, eating a lot of simple sugar may negatively affect the patient health and status. Here is an example of oral supplement that we are using in our hospital for orally fit patients. There is Ensure Plus Advanced Nutrient Friend, which is supplemented with vitamin D and omega-3, Research Support Plus, Freezubin, which is concentrated formula, high in calorie and protein formula. What about dysphagia? For patients who are suffering from the difficulty of chewing, swallowing, cough with drinking water even, sometimes they are coming to ER with GCS 13/15, so they must be referred to the swallowing team, speech team, to assess the ability to swallow. Actually, the dysphagia is reported in 13 to 57% of people living with different types of dementia and even in later stages. For patients who are suffering from dysphagia, according to the tolerance of patients, we're using the resource thicken up to be mixed with thin fluid so the patient he can swallow the fluid. Also, the beniprotein, it's a powder form of protein. They can add it to liquid or even food, so we can maximize the protein to prevent the muscle wasting in those patients. What about enteral feeding? Here is the big challenge, actually. So many patients, they coming in ER and the family refuse to insert the tube. They stay on IV fluid for 2 to 3 days. The GCS drop, sometimes went to the ICU. So it's really important to pay attention. We have to start early enteral feeding as soon as possible, within 24 to 48 hours, and to start low and go slow to prevent a lot of complications such as refeeding syndrome, which is life-threatening condition. And for patients who are staying on the enteral feeding like for more than 4 weeks, actually we can insert the big tube, the gastrostomach tube, so they can get their requirement of feeding. And here is some of enteral formula that we can use it for the patients with Alzheimer's and dementia who are suffering with muscle wasting, cachexia. Like Ensure, it's a standard formula. Tropic fiber supplemented formula for the patients who are suffering from diarrhea. Freezubin 2 kilocalorie, and also Ensure Plus Advanced. BFOT 1.5, actually, it's a semi-elemental formula, but the recommendation from the European, Canadian, and American, they goes not to give the semi-elemental formula, so we can use the standard formula for the Alzheimer's patients. And here is some products that can help them, actually. Banatrol, it's a prebiotic formula, and also it can help those patients who are suffering from diarrhea after we define the underlying cause. The high fiber formula, it can be beneficial for those patients who are suffering from the constipation. Nutri-Source fiber, we can use it for constipation and diarrhea. ProSource, it's a liquid form of protein, so we can use it easily for the enterally fit patients. So no need to go for the formula room and to wait for a long time to prepare the food there from the staff in the preparation room. What about the parenteral nutrition? As the other patients, no need to go for parenteral nutrition as the first line. But if the patient, he cannot take orally and enterally for 5 to 7 days, that time we have to go with the parenteral nutrition. And as we said before, we have to pay attention for electrolytes such as the phosphorus, magnesium, and the other to avoid the refeeding syndrome and other complications. Special attention must be paid for patients with the hip fracture in the preoperative and post-operative phase. Now there is ERAS protocol. ERAS, it's organization focused on feeding patient pre and post-operative. Also deliriums, depression, we have to make attention in these cases. The patient, he can take orally well. Sometimes we give them oral supplement even if they are obese. At least they can take it as a snack. For the pressure ulcers, I will talk more about it later, inshallah. For diabetic patient, if the blood sugar like goes more than 180, always we're using the diabetic formula, which is low in carbs, which with more fiber. How can we treat pressure ulcers? Actually, this is I did my master thesis on the pressure ulcers on patient who's suffering from the pressure ulcers on enteral feeding in hospitalized patients. And we found the good results when we give them like high calorie, high protein, and supplemented with vitamin C, zinc, and the also arginine. It can accelerate wound healing. And so many patients with Alzheimer, they are coming to the hospital with multiple bed sores and sometimes need debridement, or even it's already osteomyelitis, so reach the bone. So we have to focus on the micronutrients at this stage. What about the obesity? Are you going to restrict like the calorie for those patients? Sometimes in the clinic, the doctors, they call me and ask me to go with the extreme calorie restriction or moderate calorie restriction according to the guidelines. And what we're doing in the practice, actually, we do the moderate calorie restriction and to encourage patients to do more physical activity and social daily activity. Here is the paper published in 2021. I was really wondering with this paper, imagine in Alzheimer's disease, the gut barrier function will be changed. With more cytokines production, it might be contributed to the depressed-like behavior. And here is also another paper. It can be like a promise for the Alzheimer's patient when we're giving them like high fiber food or fiber-rich food. It can help them to improve the gut barrier function and also to preserve the microbiota. So many families were questioning in the clinic about the saffron, the effect of saffron in the cognitive function. And here is paper published in 2021 reported that the saffron may improve the cognition and stress-related disorders, but still more studies needed in this field to confirm the effect. Aracin, actually, they call it as an exercise hormone. It can improve the glucose metabolism, insulin sensitivity, and so on and so forth. Here is a message for you, dear audience, doctors, and your families also. Can we reduce the risk for the Alzheimer's disease? As the doctor here, they said the answer is yes. Just be physically active, follow healthy diet, challenge your brain, enjoy social activity, and be careful with cooking methods because it might affect negatively on our health. I found a lot of paper published in the last 5 years about the effect of playing chess on the ADHD, Alzheimer patients, and so on and so forth. Chess, it is more than a game for a researcher. Can I? Okay. At the end of our talk, it's really important to highlight that all people with dementia and their families should receive dietary advice from dietitian as a part of post-diagnostic care. Nutritional advice about eating behavior and natural food fortification should be tried first, but the use of oral nutrition supplement should not be delayed. Mind Diet is reported to be much more effective for those patients. The condition of the patients on enteral feeding might be changed quickly, so monitoring is crucial. Multidisciplinary approach with effective communication is needed to ensure patients receive the adequate nutrition for better long-term outcome and to improve the quality of life. Just while I was preparing this presentation, I found this quote for Dr. Mike Stroud-Tung from the Dr. Mike Stroud-Tung, who said, "Do not let your patients starve. And when you offer them nutrition support, do so by safest, simplest, and most effective route." And thank you.